let's discuss meningitis. Meningitis is the acute infection of meninges. Meninges are the protective membrane layer which surround the brain and spinal cord. It consists of three layers: the outer dura mater, the middle arachnoid, and the inner pia mater. The arachnoid and the pia mater are collectively called as leptomeninges. The meningitis is actually the infection of leptomeninges. Patient of meningitis will clinically present with characteristic combination of pyrexia, headache and meningism. Meningism is a clinical feature produced due to irritation of meninges. It consists of headache, photophobia and neck stiffness. Apart from that, the meningism can also constitute some other sign such as Kernig sign and the Brudzinski sign. So what is Kernig sign and the Brudzinski sign? The Kernig sign mean when we perform the extension of knee at the already flexed hip joint, it will produce pain due to the spasm of hamstring muscle. What does it mean? If you look at this diagram, the hip joint is already flexed. When we perform the extension, above 135 degree, the patient will feel severe pain due to the hamstring spasm. It is called as a Kernig sign. And the Brudzinski sign mean when we flex the neck, there will be involuntary flexion of hip and knee joint. You guys can see in this image, when we flex the neck, there will be involuntary flexion of hip and knee joint. It is called as a Brudzinski sign. Now a question arises that what causes meningitis? Remember that meningitis can be caused by wide variety of organisms such as viruses, bacteria, tuberculosis and fungi or histoplasmosis. But the most important cause of specific organism will depend on age. For example, in a newborn, from birth to 6 months, the most common cause of meningitis include group B streptococci, E. coli and listeria. From 6 months to 6 years, the most common cause is Streptococcus pneumonia, Neisseria meningitis, H. influenza and enterovirus. And from 6 year onward to 60 year, the most common cause is Streptococcus pneumonia, Neisseria meningitis, enterovirus and HSV. Remember that in teenager, the most common cause of meningitis is Neisseria meningitis, while in adult, the most common cause is Streptococcus pneumonia. Now a question arises that there are various causes of meningitis. So how we will determine that what actually caused the meningitis? So for this we use a lumbar puncture. Whenever a patient presents with a clinical feature of meningitis such as headache, meningism and photophobia, etc., the first step is to perform a lumbar puncture. We study the CSF and on the basis of CSF study, we rule out the diagnosis. This table shows the normal finding in CSF, the CSF in bacterial meningitis, CSF in viral meningitis and the CSF in fungal meningitis. In normal CSF, the pressure is about 5 to 20 centimeter of H2O. The appearance is normal. The protein is about 0.18 to 0.45 gram per liter. The glucose is about 2.5 to 3.5 millimole per liter. To convert the millimole per liter to mg per dl, multiply the millimole per liter with 18. So we will get the value in mg per dl. The gram staining will be normal. The glucose in CSF to serum ratio will be 0.6 and the white cell count will be less than 3. So it was all the normal finding in CSF. Now let's discuss the CSF finding in different pathological organisms. In bacterial meningitis, there will be increased CSF pressure. It will be about more than 30 centimeter of H2O. The appearance will be turbid. The protein will be greater than 1 gram per liter. The glucose will be less than 2.2 millimole per liter. The gram staining will be positive and the glucose CSF to serum ratio will be less than 0.4 and the white cell count will be greater than 500. And remember that the dominant white blood cell in bacterial meningitis is neutrophil. The second one is viral meningitis. In viral meningitis, there will be normal CSF pressure. The appearance will be clear. The protein will be less than 1 gram per dl. The glucose and the gram staining will be normal. And the glucose, as the glucose is normal, So the glucose CSF serum ratio will be greater than 0.6 and the white cell count will be less than 1000. But remember that the dominant cell will be lymphocyte. The third one is fungal meningitis. In fungal meningitis, the appearance will be fibrin web. The protein will be about 0.1 to 0.5 gram per liter. The glucose will be 1.6 to 2.5 millimole per liter. There will be no gram staining and the glucose CSF serum ratio will be less than 0.4 and the white cell count will be between 100 to 500 white blood cell and the dominant cell will be lymphocyte. Remember that the prominent difference between the bacterial and the TB and fungal meningitis is white blood type of white blood cell. In bacterial there will be a neutrophilic predominance while in fungal there will be a lymphocytic predominance. So it was all about the CSF finding in different type of meningitis. It is very important and it usually appear in exam. Now come toward the treatment of meningitis, that how we will treat a patient with meningitis. To treat the patient with meningitis, whenever a patient presents with a clinical feature of meningitis, the first step in a treatment is start antibiotic immediately. Don't wait for lumbar puncture result. The first step is give ceftriaxone and vancomycin empirically. Add ampicillin if listeria is suspected and add acyclovir if the viral encephalitis is suspected. Other than this, if there is a close contact of meningococcal meningitis, give rifampin or the ciprofloxacin and vaccinate against the meningococcus. The point which I like to highlight here is that what will give us the clue that a patient is having meningococcal meningitis. The characteristic feature of the meningococcal meningitis is petechia or purpuric rash. You guys can see the petechial and purpuric rash which occur in meningococcal meningitis. So it was all about the meningitis. If there is still any question, you guys can ask and stay tuned for more update.